this video, we're going to be discussing phase 1 kind of training rehab for the hip. So for my hip, the first thing we're going to be checking in is having any closing angle joint pain. So again, that's the pain in the closing side of the stretch for the whole full range of our controlled articular rotation. So checking in my hip, going through my full car, trying not to move any other aspect of the body, and seeing if I have any pain there. If nothing is there, then the next place we're going to be checking is specifically with internal external rotation. So if I'm rotating in and out and I'm feeling some pinching in my low back or in the hip or even in the groin, then we're going to look at the strategies that we've been working on with some of the other places. So for the hip, again, the first rule is, the first part is just continuing to elicit some motion in the joint itself, in those ranges of pain. So say we had it in the cars, or even with this motion, I'm having pinching with any of these motions, I'm going to back out and just move in and out. So for in this case, I'm doing a capsular car. So the hip being a ball and socket joint, the most important aspect is going to be this external internal rotation. And you can kind of pick different areas to do these for the capsular cars. And that's one way to access, or doing the cars, the full cars that I did in the beginning. But we're just going to move through its full range. So say I had pain through some part of this movement. So I'm here, there's some pain there, I'm going to back out and just continue to move my full car where there is no pain. If I did have pain in any part of the movement, then we're going to be working not only where that pain was, but more specifically in this rotational aspect of the joint. So say I'm having some stuff when I externally rotate. We're going to go down to start out into this position. So I have my ankle on top of my knee, I'm stretching my left hip, and I'm going to try to push my left knee in line with my left ankle. I'm going to start to arch my low back, so pushing my butt through the floor to kind of find a stretch. If you can go all the way and you're not finding a pinch, then this area is good. Let's say we do have a pinch. I'm going to back out, so relax the abdomen again. So I was tilting my pelvis forward, so I'm going to come out where I'm out of that pain. And then I'm going to do a positional isometric. For this one, I'm going to try to drive my ankle through this other knee. A couple seconds, and relax. See if I can arch my low back, get deeper into that stretch. That's for external rotation. For internal rotation, I'm going to be on my side. You can use a chair or a band to kind of help you find the stretch. This guy down. So you can place a block in between, and you can use either a strap or something to stretch on. And I'm going to try to lift my ankle up, finding a stretch in the hip. And then the same thing. So if I find a pinching spot, I'm gonna back out of the stretch. And in this case, say I'm using this chair, this stool up here. I found a pinching spot maybe there. I'm gonna come out of it a little bit. So the stretch was this way. I'm gonna do an isometric contraction away from the stretch, driving my ankle through my stool or whatever I'm using to stretch. For this one, you might want something a little harder. So maybe not like a stretchy band, but like an actual strap, like a belt. And relax. And then we're checking in again. So with each of these position isometrics, we're looking to continue to increase the range of motion without pain. Those are the two most important ones. If you did have pain in any of these other ranges of motion, then you can continue to elicit that same kind of response. So say I'm having it with hip flexion, I'm gonna come up to where I feel the pain, back out, and do the opposite. So for this one, it'd be kicking, driving down with the leg, and relax. If I'm having it coming out, I'm gonna stretch coming out until I get the pain, back out a bit, and now I'm driving in. So trying to squeeze my hip closer together, squeeze the floor. You can do it from here or from here. If you're having it coming in, then you probably want to be in this position, like so. And I'm going here. So finding where I find a stretch, you might have to like prop the leg up. And then the opposite would be pushing down through the floor and then seeing if you can get more range. So again, continuing to work range of motion without pain, and then working our position isometrics right outside the ranges of pain. Once we have good range of motion, then we continue on with the phase 2.